Wonderful. Well, muy buenas tardes and bienvenidos. We are so excited to have you join us today. Thank you for joining our Policy Plática, Confronting California's Physician Shortage with Policy and Urgency. My name is Dr. Ceci Aquino, and I have the honor of serving as Executive Director at the Latino Coalition for a Healthy California. Today, we're so proud to introduce you to our newest and shiny campaign, More Doctors for California, or MD4CA for short. This campaign is really built around one urgent goal, ending the physician shortage that continues to leave too many of our communities behind. Latinos make up over 40% of California's population, but only 6.7 of our California physicians are Latino. That's not just a gap, it's a health crisis, and it's one that we can no longer afford to ignore. MD4CA is a united and coordinated effort to reimagine how we grow, support, and retain a physician workforce that reflects the rich diversity of the state. From pre-K to practice, we need to continue to invest in our California future. Our future really depends on preparing all of our students, including those young Latinos who dream of one day becoming a doctor and who make up the largest share of our education system to enter those medical careers. We're so grateful to have you with us today, and we hope that you'll leave not only informed, but ready to take action. We need you in this fight. So with that, let's get started by grounding ourselves in a little bit of context and why we're here today. Let's go to our slides. So, what is our challenge? California doesn't have enough doctors, especially in rural and underserved regions. This is a supply problem and a regional equity problem. What does this mean? We mentioned that Californians make up over 40% of the population. By 2050, will be 50% of the population. And yet we only have 6.7% of those Latino physicians. Why? What's going on? Academic research tells us that we have over 500 years to reach parity. We can't wait that long. We have to get started today. And we know that over the years, we have been building the work and the hard, intentional policy transformation that it takes to build out programs, initiatives, pathways that ensure that success. And we are coming to this work because of that amazing work and career-long dedication to this work. And we know that we're here where we are today because of those great efforts. But now it's time for all of us to really come together and make this even more of a success and that intentional strategy for today. Why? Because we have these shortages. Over 11 million Californians lack adequate physician access. We know that there's a regional strain. Our Central Valley providers serve 42% more patients. That representation gap, right, that we talked about, 6.7% of doctors being Latino is not enough. And delays in care. We know that the longer we have to wait as patients, the further we have to travel, the worse the outcomes are. And we know that health disparities don't wait around, that pain is present, and that we need those doctors who can understand us, who can support us in that process. And it takes initiatives that are intentional to address those disparities. So what is the opportunity? We really can solve that shortage by unlocking California's largest untapped talent pool. You heard me say over 40% of the population in California is Latino. By 2050, will be 50% of the population. Let me share a couple of other things. 48% of California's children are Latino. 40% of our California labor force is Latino. 54.9% of students in California's public school systems are Latino. 48% of students in Cass state systems are Latino. 46% of students in community colleges are Latino. So when we're talking about that supply and demand, we know that Latino students are the solution. And so we're here to say our Latino students are ready. We just need access. We just need to strengthen the pathways that currently exist, expand those pathways to ensure that more students have options and have the access to really ensure that dream comes true. And how do we do that? So with this campaign, we are looking to inspire students, community, mentors, advisors, system leaders to really envision Latino students as doctors. That is part of our narrative work, because we know that the way that we tell our stories, the way that we touch hearts, right, at that human level, is how we're going to all come together to ensure we advance this. We need to continue supporting, so strengthening those financial support programs, pathways, initiatives to ensure access to that medical school journey. Connecting, strengthening existing pipeline programs that connect students to opportunities such as community colleges, to CSUs, to medical school, and ultimately advancing. So securing that lasting change by ensuring that our students can graduate successfully from medical schools and go successfully into practice. So how are we going to accomplish that together? Let's look at the 11 initiatives. So together, and we'll hear a little bit more from our panelists about how this work really came together to envision these very specific 11 policy initiatives. We wanted to have a collective and tested approach to the work. We know that already we don't have to reinvent the wheel. We know that there are programs that are very successful in ensuring access for Latina and Indigenous students to go into medical schools. So what is that pathway that we're intentionally looking to strengthen? We start from pre-K all the way to practice. So we're looking at that overall journey within the medical school journey. So you heard me mention our narrative change campaign. That's in that pre-K to high school sphere, right? Because we need to inspire the minds of the youth, but also those mentors that are advising on where to go to college, what scholarships to apply to. We need to inspire the whole system to envision those Latino students becoming our doctors. We're looking at data, right? How do we create a workforce data repository that's helping us keep track of those gains over the years? When we talk about college and pre-health professions, how do we strengthen funding for medical student pathways, right? How do we make sure that we're investing in the pathways that we know work, that help us get from point A to point Z? How do we embed community colleges into the pathway? We know that our largest number of students are found in community colleges. So how do we make sure that we come to them and say, hey, these are opportunities that are available to you, and increase access to those? How do we collaborate with California institutions, be it our administrative departments here in California or medical schools, to make sure that our processes are holistic when we're looking at bringing more students into the force? How do we expand post-bac programs? We know that post-bac programs help our students be successful in the application process. So how do we ensure that access to those programs is happening? When we talk about medical school, how do we ensure that holistic admissions is ensuring the fairness, the equity in terms of being able to apply and successfully commit to a medical school? How do we expand UC medical school positions through the PRIME program? We know that PRIME programs are also extremely important to ensure that connection from medical education to practice. And then when we talk about graduate medical education, looking at the GME program, how do we continue to revolutionize the consortium? How do we leverage residency programs within GME? And finally, practice. We know that we also have international medical graduates. How do we make sure we plug them into service when it comes to our low-income communities and those disparities across California? So our work is ensuring that these 11 initiatives continue to advance We have to prioritize, stay strategic, stay nimble and flexible, right? Given the social political context that we're in. But we are here to fight. This is a campaign that is full of hope because we are planting the seeds today that will continue to grow regardless of the chaos that we're really facing when it comes to federal attacks and other difficulties that we are continuing to see on a day-to-day basis. And how will we achieve this? We can only do this in partnership, hand in hand with you. So we're leveraging multi-sectoral partnerships, ensuring that we're working with medical schools, higher education systems, regional health systems, community-based organizations, and looking at leaders who have been working on workforce and policy solutions across the board. We want to ensure a coordinated and strengthen statewide solutions and strategies that will create that lasting systemic change. And why now? As I mentioned, we can't afford to wait 500 years for parity. When we talk about those federal and structural pressures, right, we started the year, help me think back to where we started this year, right? There were fires, climate crises all around us. And then we had to be responsive to that as a state and ensure that our families were safe when those fires were happening. But quickly, we saw more difficulties coming our way. Traumatic federal administration, ICE raids that were kidnapping folks from the streets, HR 1, and now we're facing HR 1 implementation, right? Those federal attacks on health and safety net infrastructure, and our California state budget deficit. What does that look like and how does that translate or impact our health? We knew that coming into this year, California health is fragile. We all endured the COVID-19 pandemic. We're still continuing to see acute COVID-19 cases, long COVID. Our communities are still recovering from those socioeconomic disparities that came up during the pandemic. Families have been unable to leave their homes and are basically facing a fear pandemic since this administration has been in office, leading to folks needing to quarantine again. They can't go out of their house to go to the clinic. They can't go out of their house to buy groceries. And those mixed status homes really have had to come to the rescue of our vulnerable community members. We're seeing a chilling effect. There have been data breaches that have left people even in a more vulnerable position. So we're talking about folks either disenrolling or pausing access to formal government systems because of that. And we know that our health disparities are exacerbated, be it around mental health, healthcare, regardless of what social determinant of health we're looking at. We know that those disparities are exacerbated. So we cannot wait. This campaign is urgent. We need to have it now. And here's the key. Sure, we're talking about Latina students, but the good doesn't stay within just our community. We know that the good expands beyond just this community and really serves to support California as a whole. That is the beauty of public health, that by being able to lift up and support one community, other communities are also brought up and supported. Access continues to increase, and hand in hand, we can continue to make this state a stronger one. So with that, let us move forward to talk and introduce here with our amazing panelists who will be sharing more about where this campaign began, right? We're going to get the backstory. What was that plan that got drafted on a napkin? We want to hear more about the vision, right? And how we're going to do this together. What are those steps that we're taking to continue those partnerships? Let me have the honor to introduce our amazing panelists here. We have Martha Santana Chin. She's our MD4CA co-leader and CEO of LA Care Health Plan. Welcome, Martha. It's an honor to have you. Dr. Flores, he's also our co-leader for MD4CA, medical Director at Atlas Family Care Specialist Medical Group, and President-elect at LA County Medical Association. Welcome, Dr. Flores. Dr. Pooja Mittal. She's our campaign member at MD4CA and strong leader as Chief Health Equity Officer for HealthNet. And in a little bit, we'll see Assembly Member Dr. Joaquin Arambula of District 31 in Fresno, strong and powerful member of the California Latino Legislative Caucus, join us later in the program. Thank you all for joining us today. We're excited for this conversation. All right, so to get us started, we want to start with the bigger picture, the story behind how this campaign began. And Martha, let me pick on you. You've played a pivotal role in co-leading the MD4CA campaign from the very beginning. This is your brain baby, and we're seeing it grow up and strengthen here right before our eyes. So tell us a little bit about that vision, the urgency behind it, what has been decades in the making, and can you take us back to that moment where this work began? What moved you to step into the space? And what does building real systemic change mean to you through this campaign?
So, Cecia, thank you, first of all, for hosting this very important conversation. It's more important now than ever that we all work together to address some of these underlying structural issues that we've been having in our healthcare system. And this is, I think, a key ingredient. So, I mean, I'll start by just sharing that there are many people in the state of California who have dedicated their careers in some way, shape, or form to getting at the heart of some of the issues that we're trying to address today. And so I happen to have the privilege of being able to tap on the shoulders of people who have understood the problem, took action to develop programming and pilots and a lot of, really good foundational work that essentially is something that we're building on now. And, where this all started was Dr. Flores and I were having a conversation a few years ago about the critical need to improve outcomes and quality and access for people in underserved communities. I, much like Dr. Flores, have been working with individuals in the low-income segments of LA County, but also across the state. And specifically running Medi-Cal programs, both on the provider side and on the health plan side, as well as covered California plans to serve individuals that have both Medicare and Medi-Cal dual eligibles. And one of the things that has been a very persistent problem is access to timely care, primary care and specialty care, overrun emergency departments and hospitals because people are trying to access care in whatever which way they can, and the need and opportunity to improve quality and outcomes, whether it's, HEDIS metrics or member satisfaction surveys, or even, providers and the way that they're feeling about the healthcare delivery system. And in my prior role for HealthNet, I ran the health plan operations for the entire state, as well as the Medicare and the Medi-Cal program. And actually, Dr. Mittal and I had the joint responsibility of increasing quality dramatically to make sure that we were able to demonstrate that we were caring for these underserved populations as well as commercial populations are being cared for. But underneath that, we knew that there were structural issues, right? We knew we didn't have enough physicians in the areas that we were serving. We knew that in order to get at the heart of improving quality and access and service and satisfaction, we had to have physicians that were culturally congruent and able to understand and connect and build trust with the communities that they were serving. And so, Dr. Mittal and I and many of the folks at HealthNet before my prior role here were, just lamenting about that issue and how we might get after it. That led to a conversation between Dr. Flores and I where we actually were asked to sit on a panel and we were sharing our, various perspectives on the same issue. I had the health plan angle, and Dr. Flores had obviously the provider angle, and residency program angle, and just the community leadership angle. And after that discussion, Dr. Flores and I looked at each other and said, "Okay, that's all well and good, but somebody's got to fix it. Who's going to fix it?" And so we committed to one another that we would lean in and figure out how to build on all of the foundations from the past, from leaders like Dr. Bob Montoya, Dr. Hayes Bautista, Dina Buller, Dr. Jennifer Lucero, like many individuals who, over the course of their own personal careers, have been laying the tracks. And so we agreed that we were going to do something together to, not only admire the problem and make it known that there was a problem, but we were going to get after it. And what we agreed to do is to develop a strategic plan that had a very focused set of priorities that we were going to support and champion together and through coalition. So Dr. Flores called all his friends who, thankfully they all answered the phone and agreed to lean in and provided some very generous support, bringing their insights, their perspectives, their time and energy to the table to inform essentially the roadmap, which are the 11 initiatives that you outlined, Cecia. And the good news is that many of those initiatives, it's really a matter of scaling, right? It's not net new activity that we have to reimagine and completely redevelop or develop from ground zero. It's work that we're building on. And, I do have to say that I was very fortunate that, prior to my role here at LA Care, HealthNet was, trusted me, trusted Pooja, trusted, our Lisa Coe and others who partnered with us on this, and were very generous in their investment to get this going. And so we brought in a firm to work with us on the development of the strategies, development of the roadmap. There's a lot of substance behind everything that we shared today that you covered in a few slides. But we know how to get after it. And so I'm really excited about the next chapter of this coalition and this work. MD or More Doctors for California is exactly what it says. It's intended to address the math problem. The math problem that we have in the state of California is that 40% of the population are Latino, but only 6.7% of the physicians are Latino. And we also have a provider shortage. It's very well documented that we have a physician shortage. And by the way, we also have budget constraints. If we don't address this problem, where people are going to continue to have no choice but to get access to care in very expensive emergency rooms and in hospitals. If we invest upstream in increasing the base of primary care, increasing, the appropriate specialists to care for needs, we will also solve some of the budget problems, right? And so I'm very excited about where we are today. And, I also have to just do a quick little plug and shout out for our friend, Dr. Connie Casillas, who I don't know that she's on the line, but she runs an organization that is a phenomenal organization, Mi Mentor, that has focused on mentoring young people who are committed to getting to the health professions to, find their way, find their path, and get connected with their opportunities. And they have an open position for an executive director. So if you're passionate about this work and you want to make a difference, I highly encourage you to, go to the Mi Mentor website and connect with Dr. Casillas on LinkedIn. We need more talented individuals as part of the journey here. So we're gonna get after it. We're gonna fix it. It takes strategy, it takes focus. And we're just so fortunate that so many leaders came forward and said, hey, here's how we are able. Oh, Dr. Casillas, I see she's on. Awesome. That so many leaders came forward and are rolling up their sleeves to work through this with us. And thank you, Cecia, for you and your organization for stepping up and helping us lead the next chapter of the work.
Thank you so much. And I love that shout out. This is how we get the work done, right? When we support one another, when we lift each other up and ensure that we're moving forward in partnership. So let's pull in Dr. Flores. So you were in this initial conversation about dreaming, right? How do we make this a reality? And Dr. Flores, you've been on the front line of this crisis long before MD4CA existed. As a physician, medical director, longtime health equity advocate, you've seen how this shortage plays out in real time, in the exam room, in neighborhoods, and across systems. So from your perspective, why now? What's different about this moment? And why is a coordinated campaign like MD4CA so urgent and necessary today? What's at stake?
Thank you, and I join my colleague Martha in thanking you for your leadership, Dr. Aquino, and Latino Coalition for Healthy California, and really helping move this forward. So I'm a product of affirmative action, and I've been working a beneficiary of pathway programs for 50 years, and so I've had a chance to see all the efforts over those last 5 decades, multiple efforts to diversify the workforce, particularly the physician workforce, and address the needs of underserved communities. And part of the friends that I called, as Martha referred to them, were people that I've met along the way who are doing really important work, many of whom are in the audience, actually. Really thankful for them to join us today. But the crisis is at a point where we know that thanks to the work of people like Dr. Arambola, who we'll hear a little bit later, Senator Maria Elena Durazo, the Latino Caucus, we now have almost universal coverage of all people living in California, including the undocumented. So we're at 95% coverage. And what it did, unfortunately, is it exposed the critical shortage of physicians in California, particularly those that work in underserved communities. The California Department of Healthcare Access and Information released a report last year that found that 14 million people in California live in primary care shortage areas. This is a third of the population of the state living in underserved areas, and over half of them are Latinos, and most of them are Medi-Cal or uninsured patients. So the crisis is real, not only the lack of access for those who have covered, but also the disproportionate impact on underserved communities. And that's why we see the disparities in health, the disparities in addressing the social drivers of health, and even, I would say, the social drivers of academic success for young people who are born into poverty and who really don't have many chances. And so part of this strategy of this coalition is to create a comprehensive movement, as you mentioned in your opening comments, Dr. Aquino, to start with K through 12. And as a family physician, I like to say that we start at the first prenatal visit, because it's about engaging the mom in that healthy baby, engaging the mom in that future education, engaging the father, even if they're not married, in the future development of that child, but many times also the mother and father in their own education, because these are young people who are coming from adverse conditions. So part of this is addressing those social issues that impact our ability to have representation. The second part of this is that the evidence is pretty clear. As Martha mentioned, we need access to specialists, but equally important, if not more important, access to primary care, because studies have shown that access to high quality primary care not only keeps the population healthier, but reduces costs downstream. The National Academy of Medicine released a report in 2021 that showed exactly that, and that strong primary care can reduce costs by anywhere from 10 to 20%. So we're spending almost $5 trillion a year on healthcare. Imagine if we had $1 trillion in savings, how much more we could invest in developing more workforce and developing the social services that low-income and vulnerable communities need. So this is a really important initiative from those perspectives. It would be great for those of us who work in underserved areas to be able to have allies that not only can amplify what access we are able to provide to those vulnerable communities, but also to develop a succession plan that looks into the future as we begin to retire. One of the challenges we have in California is the aging of our physician workforce. And the last piece of this, why we focus on physicians initially, we know that other health professions like nurse practitioners and physician associates and others are really important, but it's really starting with a laser focus on physicians will help us address all those other issues. Just like you said in your opening comments, that if we can fix the underrepresentation of Latinos in medicine, we'll be able to fix it for every other group that's underrepresented, including low-income white students who are also underrepresented as much as people of color in the health professions. Lastly, physicians control 80% of the healthcare dollars. So We're spending $4.8 trillion, $5 trillion a year, or in California, $500 billion. If we have the right amount of workforce of physicians, we can actually have them be able to invest in prevention and reduce unnecessary costs on the expensive end, as Martha mentioned earlier. So I'm excited about this coalition. I thank the audience for joining us, because we will be calling each and every one of you to help us in this process, including a couple pre-meds I saw signing in, because you will be the generation that leads us 20, 30 years from now. So thank you.
Exactly. Thank you so much, Dr. Flores, for anchoring us in the urgency of this moment, what it's taken to get here, and the work that it will take to get us to the finish line. Dr. Mittal, I would love to invite you in. As Chief Health Equity Officer and practicing physician, you're uniquely positioned to see both the systems and the people impact by this gap, not just what we see in the data, but actually in practice. So what role does representation play in patient outcomes? And from your perspective, what's still missing in our approach to solving this crisis?
Thank you so much, Cecia, for the invitation, and just so honored to be here with all of you. And thank you to all of the audience who's here partnering with us, because I already saw some things in the chat that I was like, we're going to reach out. I was very honored to be part of this work, because so many of the folks that are at the table here are some of my childhood heroes. And the first time I met Dr. Flores, I was like, oh my gosh, I've heard of you since I was a kid. So I'm very excited to be part of this journey. Representation is foundational to whole person care. When people have a connection with their doctor, somebody who speaks their language or has the same lived experience, or understands their culture, they can trust them more. They're more likely to follow their recommendations, and they're more likely to come back, right, and see them again. And all of those things lead to better health outcomes. And so that's why really fundamentally this is so important. For me as a physician, I work in an FQHC. I've always worked with a primarily Latino population, and I speak Spanish. And when I walk into a room and I can speak Spanish, patients always say like, "Oh, qué bueno habla español." But it isn't just enough, right, to be able to speak the language. I have learned over the years all of the cultural nuances that go with different people from different regions, and how to understand what their experience is, how to understand what matters to them, what their family structure is like, how they discuss illness culturally. And all of those things have allowed me over time to be a better and better provider, right, to those patients. But having somebody who can walk in the door and not only speak the language, but have that cultural nuance is invaluable to building trusted relationships. And so I really see this as a critical next step in our being able to have an equitable approach to caring for our population. And this issue is really compounded by the fact that medicine is the largest legacy profession, right? So we know that only 6% of our physicians in California are Latino. And that doesn't only affect the people who they're caring for now, not having enough providers, but also for the future, it makes it harder for people to get into the profession, right? Because the biggest indicator for whether you're going to become a physician is whether your parent was one, right? And so there is so much that we need to do to build systems to overcome all of those additional barriers, right? Understanding, and this is why programs like Mi Mentor are so important. Supporting people along the way, giving them a path that they can see, starting early so that people can see themselves in the profession, and also making sure that people have the mentoring that they need along all the points where it's very difficult to be able to get to that end goal. And so, cultural representation is critical, and there's a lot that we need to do to make sure that we're overcoming all of the barriers to get there.
That's beautiful. And thank you so much for highlighting the need to address the structural barriers, right? Sometimes the dream is there, the energy, the ganas is there, and our students are ready to go. But when they keep hitting the wall with systems, we know that it's not that drive, it's not the community itself, but it's these systems that need to be change, transform from the inside out to make sure that we're increasing access. So thank you for rooting us in that. And now I am so happy to see here on screen Assembly Member Dr. Joaquin Arambula. Thank you so much for joining us. We're grateful you could be here. Assembly Member, as a physician yourself, the first Latino physician elected to the California State Assembly, our chair for Assembly Budget Subcommittee number 1 on Health and Human Services for over 7 years, 2016 to 2023, and as a powerful member of the Latino Legislative Caucus, your leadership has been a driving force for equity and better outcomes for California's working families. From your perspective, what do you see as the most urgent action California must take to expand our physician workforce? Why does it matter? And how can partners like MD4CA support that work?
Well, thank you, Dr. Aquino, for having me on this panel. And I just want to extend a welcome to all of the other panelists. I'll follow up on what Dr. Mittal was speaking about, though, that legacy admissions being such a preference and being such a predictor means that the status quo has given us the results that we have. And so the urgency has to come in accepting that as our basis. That if we don't want to make changes, then you just keep going on our current path. But for many of us who find it unacceptable with the current level of representation, who are not okay with the health inequities that we have baked within our system, you have to see that as enough of an issue to want to work on any of the 11 initiatives that you've highlighted. And I just want to uplift them. I think it's important for us to focus on those pathway programs, to make sure that we're being intentional to meet students where they're at. Many of our Black and Brown students go to community colleges, and so we need options that are working at their earliest levels. I oftentimes will talk about you can't be what you can't see. And for too many of our community members who may be first gen, who don't have the family support, it's often difficult for them to be successful in pursuing a career in medicine. And so we have to make sure that they have mentors and supports, peers who are around them, who will help to provide that holistic support that's needed. I'm grateful that you've worked on a broad swath of initiatives that focus on post-baccalaureate as well as GME, on international medical graduates, on all of the ways that we can help to diversify. Now, I also will say in years like this where our budget is challenged, it's important for us to lean into programs that are already existing and to try to scale them, to grow them, to better meet our needs is an easier sell than to create a program from fresh and to start something new. But there are ways that we can look towards success stories, highlight them, and try to then drive change through that. I'll elevate a bill we got signed last year in AB 2080, a bill that will ask our UCs, since they're constitutionally protected, to give us the data that's necessary in regards to diversity and who they're admitting, as a driver to then highlight schools that are doing it well. And I don't mean to pick a favorite child, but I will uplift that UC Davis has had tremendous success over the last several years by starting to focus on different factors. And their focus has been more on economic integration. That we need to be pulling from all levels of the socioeconomic scale for us to effectively then diversify it. Now, that's a way that insulates us from much of the federal conversation that's occurring regarding DEI. It helps us to make sure that poor people have an opportunity to become our next generation of doctors. Social mobility should be a goal for many of us. It shouldn't just to allow those who are privileged enough to practice medicine that their kids are given legacy admissions. But we should be pulling from all levels so that we can achieve that. UC Davis has done it to such success that I'm hopeful as we start to highlight these data points that we can then create incentives that would allow other colleges, are there medical schools that are focused on wanting to increase those pathways to be focused on economic integration as well?
Thank you for that. And if we can go a little bit deeper into that comment around the regional approach, right? We hear in Central Valley about the long waits, not enough doctors, communities who feel left behind year after year. What does it mean from your perspective as both a physician and a legislator, leader? What does it mean when families can't get the care they need? And what do we actually need? What does it take to make sure that every region can access timely and cultural competent care?
I'll say if things were working, I'd still be practicing medicine. I truly enjoyed being able to provide care. For those of you that haven't, I haven't had the chance of meeting thus far. I worked in Selma, which is a small farm working town. It's the raisin capital of the world. It's a rural town of 25,000 people. And oftentimes what we saw is when they were unable to access health care due to provider shortages, they then had longer waits. They then had to drive further and further and take more time off from work, or if they could afford the gas and the time to get away from it. And it ultimately led towards worse outcomes. Things that are preventable, that are treatable, usually with medications, then were coming in the last stages. It was strokes and heart attacks and kidney failure and amputations. And we know the effectiveness of getting upstream and to providing care, especially if it's culturally and linguistically competent. I was really drawn towards the comment earlier about how important it was to establish that trust, to meet people where they're at. We see the opposite happen too often in hospitals, where it's the kids or the family members who are being asked to translate. But to have a provider who's had lived experience, who comes from similar backgrounds, who speaks the same language, goes a long way towards making people feel more comfortable, so that they'll then hopefully follow through on the treatment plan and the care that they so desperately need. But fundamentally, to me, I grew tired of seeing people having such poor outcomes that I wanted to do more about it. And it's a large part why I ran. Now, I'm grateful that while we have had some success throughout the state, I will continue to highlight that there are regional disparities, geographic disparities. I was the medical director for the emergency department that I was at, and I couldn't recruit enough doctors. They wouldn't come to our communities. I couldn't pay them enough to be able to care for our communities, and I quickly realized it's if I can't recruit them, then I have to grow them. Then we have to figure out how it's our kids and our sons and daughters who are then going to be that next generation of providers. And so I'm really happy to share with this space. If you weren't aware, UC Merced has broken ground on a medical education building. They've accepted bachelor students who are guaranteed admissions into a medical school that will begin in 2027. With a graduating class of 2031, we have an opportunity to help to make inroads so that we don't have to wait 500 years. But I will just say it's the first public medical school we've opened in California in almost 50 years. And if we're serious about wanting to enable our providers to go into primary care, then we have to also be focused on debt load and how much they'll own afterwards. And the benefit that comes from going to a public institution is tremendous. So I just hope that answers your question.
Thank you so much for that. And thank you for rooting us in that personal commitment, right? And I think that's the beauty of this campaign. Many, if not all of us on the screen right now, and folks in this coalition, all of us have faced those disparities at a very personal level. And that's what keeps us going. That's what keeps us rooted in this work, and why we want to see more opportunities for more students like us. So thank you for sharing that and rooting us in what really needs to happen here. I want to open up the room to our other panelists, and please jump in here. this question really goes a little bit deeper into our policy initiatives. Those are 11 initiatives that we covered, that pipeline from pre-K to practice. In your perspective, what is one of those, if you had to choose, I know it's hard, but if you had to choose, which of those 11 initiatives is most likely to move the needle on California's physician shortage, and why? Maybe Dr. Flores, we can start with you.
Sure, I can jump in. Thank you. It's a great question. I think from my perspective, it's been really refreshing to see more medical schools. And again, thank you, Dr. Arambula. UC Merced would not have happened without your leadership. And we hope that Dr. Jasmeet Bains can do the same thing in Kern County. We're seeing more medical schools, including osteopathic schools. And I want to tip my hat to the osteopathic schools too, including AT Still, which has really innovative programs. They're based in Arizona, but they're transforming education in underserved areas throughout the West Coast. So we're seeing more openings. What we need is more GME slots, more residency slots and fellowship training as we see more medical students graduating from California medical schools, that we can actually keep them here in California. We're still exporting a lot of young medical students to go get training outside of the state. We need to repatriate them and bring them back. And then secondly, besides increasing the number of GME slots, we need a Medi-Cal GME program. For those of you who are familiar with how residencies and fellowships are funded, is through the Medicare program. But a teaching health center that focuses on Medi-Cal and uninsured, or a safety net hospital that's serving Medi-Cal patients for the most part. Actually, both of those institutions who have residencies get penalized for their mission and their location because they don't get Medicare patients, therefore they don't get Medicare dollars. And we see the teaching health centers struggling. Every time they finish a grant, they have to scramble and get another grant just to keep the residency cohort going. So a Medi-Cal GME strategy would be critical. So increasing GME slots and bringing in Medi-Cal GME, to me, are the two linked approaches I would prioritize.
Beautiful. Thank you. Dr. Mittal?
Yeah, in the current environment, I do think a lot of what we need to do is preserve some of the progress we've made. And so I think expanding on some of the existing programs like prime and post-bac programs are ripe for continued progress. So expanding those slots allows us to take work that's already been done and build on it. So I think those are the two places I would go. I would like to call out the comment in the chat, which I think is something that really has been keeping me up at night, which is this federal loan repayment restrictions. They're decreasing the amount that people can take for federal loans. And I too am worried about predatory lending and how this stands up yet another barrier for students from underserved backgrounds to actually feel like they can afford education. And so to me, that is another pathway that we're going to have to look critically at and see where we can sort of mitigate some of the impacts that we're going to see from HR1 around the federal loans.
Definitely. And I think you're highlighting that context that we're in, right? And that the fight, we have to be stronger now than ever to fight against those incoming battles. Martha, I want to loop you in here.
Thank you. Thank you for the question. It's great to hear all the other panelists and where they would really focus. I think one of the fundamental problems we have in the system today is we don't have enough money, right? I mean, when I know Dr. Aquino, there's polling that you recently did, right, to ask the question about what is the number one barrier to getting into the profession, and it's financial barriers. That's the number one issue. And so one of the initiatives is really around this idea that we've got to reimagine the financing of all of this, that we have to think about this holistically. It takes money, right, to get the test prep that you need in the community college system or in the Cal State system or to get into medical school. Like along the way, the communities that we're speaking about today need a generational investment. If we can invest in one generation to make a significant impact, the rest will kind of solve itself, I believe, right? Generational investment. So helping individuals who have the will, the ganas, the potential, the drive, right? Just have access to those extra sets of supports that we know many other communities have access to. Get them going along the way and be bold in how we're doing this, right? Can you imagine if we were able to have, and I stole this idea from a friend of mine who will remain nameless, but his initials are HF. Can you imagine if we had an endowment in the state of California that was squarely focused on supporting the financial needs of these communities through the pathway, right? I don't know about you. Actually, I do know about many of you because many of you share my story. I had to work my way through college. I'm sure many of you had to work your way through college. Many people on the line and many of the individuals that we're targeting here are folks that had to work to support not just themselves, but their families, right? And so what if we could set something up where we could invest in every phase of the process and target these low-income communities in a very intentional way so that when they do get out of that residency program and go back into our communities, they can actually afford it. They're not debt burdened. They are able to, buy their first little home that is going to get them to start to build the wealth that they need to then help the next generation. So I believe that if we can get creative with some public-private partnership to get at the heart of this issue, there's a lot of programming already existing in the state that just needs funding, right? There are residency programs out there that just need more slots. There are medical schools out there that just need more slots. There are post-bac programs that work. There's community college pathways that work. Yes, there's new work that we have to do upstream, right? K to 12, that also requires investments. But I think if we can really put our heads into investing in the holistic set of initiatives with an eye on, getting rid of the barriers financially across the way, we'll make a significant impact and get this generation ahead and for the next generation to prosper as well.
I really appreciate that you brought in that economic perspective. We know that increasing access to a career pathway is really, we're talking about breaking poverty cycles here. And it really is a wise investment opportunity. When we look at the Latino GDP in California last year, or in 2023, it was over $1 trillion. And if we think about the contributions that the Latine and Indigenous communities make in the state, we are the workforce that supports California in becoming the fourth largest economy in the world, right? And if as a state, we are the fourth largest economy in the world, we need to start acting like it and invest in our community. And this is a way to do it. So thank you for focusing on that. Dr. Arambula, you being part and having gone through that pathway yourself, where do you see that connection point where we could leverage and strengthen?
I'll speak for part of my community who oftentimes just doesn't have the same access to resources or information. If we're waiting until people are in college, it's oftentimes too late. And we're going to need to get further and further upstream. There was a different Dr. Flores, Dr. Kathy Flores, who helped to inspire me, who's worked with the Doctors Academy when I was providing care. So we could have students who would shadow us who were in junior high or high school. They had to start learning the professions. And I know we're focused today on creating more doctors, but the healthcare field is awfully broad. And our ability to show them the options that they have, that they're wanted, that they're needed, that they're valued, that there's a strength that comes from their diversity, that their ability to speak multiple languages should make them a better applicant when they're applying for school later on. by having those conversations early on enough, you can help to instill the hope within them. Because I think for many, they just never see themselves in these positions. And we're going to have to start a little bit earlier to make sure that we're supporting them appropriately. So whether that's strengthening the pipeline programs, focusing on the mentorship they get once they're into colleges, or supporting them after they're into colleges, those are all great ways that we can do this. I would just highlight, since we talked about GME and residency slots, many of those limitations come from the federal government. And it is interesting, and I will have to take back, Dr. Flores, that idea of what we could do on the Medi-Cal side of things to focus on GME. But I think the further we can get upstream, the better off we will be, because we can start that dream earlier on for many.
Thank you so much for those insights. I think we're laying it all on the table here, right? We are committed to California continuing to be that leader, that powerful, setting the stage state. And we're so proud of that. But in order to continue to play that role, we need to invest in our Latina and Indigenous community. And one practical solution is ensuring that we have more Latina and Indigenous doctors practicing here in California. We're talking about not just a cultural change, right? But we're also talking about improved healthcare outcomes, an improved economy, and a better California for all. So let me thank all of our panelists today for joining us, and to everyone else in the audience who joined us today. We talked about those real barriers, but also the real solutions. And like we all shared on this panel, the only way to do that is by working hand in hand to ensure that this work moves forward, is successful and sustainable. If you're ready to help us close that gap, we invite you to become a More Doctors for California ambassador. Our team is going to drop our ambassador toolkit in the chat. We invite you to please spread the word, join us on this campaign. We have multiple places where you can plug in. If policy is your bread and butter, join us for our policy committee. If you're passionate about communications and narrative change, we'll be launching our narrative campaign committee next year. Join the coalition, help us move this towards the finish line. And we'll be having more conversations like this in the future. So please stay tuned for our next conversation. And we'll follow up with any of you who had questions and place them on the chat. We're making sure to take note of those and ensure that we can follow up to address those questions. Again, thank you so much for your time today. And in the minute that we have left, let me just open up the room here. Any last thoughts from our panelists?
I just want to thank Latino Coalition for really keeping us together and helping us plan for next year and the years beyond. So Dr. Aquino, thank you to you and your team for all the work you've done.
Thank you so much.
Yeah, and I would just double down on your call to action, Dr. Aquino. If you're passionate about this, if you've got talent to give, get involved. We're going to need all the voices that we can and all the muscle that we can behind this.
Beautiful.
Would just add that, a big part of this campaign is narrative change. And that means that we need your stories also to drive that, because we need the data, right? So that people understand what the need is, but we really change people's hearts through stories. And so I would just say, bring your stories and bring your perspectives, and we have to roll our sleeves up and get to work.
Change can happen. In the 10 years I've been in office, I've seen California enroll 1 million Californians, regardless of immigration status. Now it's our responsibility to make sure that we have the providers to care for California as well. So let's roll up our sleeves and let's get the work done.
Beautiful and powerful words. Thank you so much. With that, let's continue to roll up our sleeves and do this hard work. Appreciate you all. Have a blessed day.